1910, a single report quietly closed 3 out of every 4 medical schools in America. The Flexner Report, funded by the Carnegie and Rockefeller Foundations, both with significant investments in the emerging pharmaceutical industry, declared that schools teaching herbal medicine, homeopathy, and traditional healing were unscientific. Within 20 years, most of them were gone. The knowledge that your grandmother and her mother and her grandmother had used to keep families alive, from Civil War battlefields to the flu pandemic of 1918, to every sick child in every Appalachian hollow, was reclassified as superstition. Number 7 on this list was used by surgeons during the Civil War, that the U.S. Army still teaches a version of it to combat medics today. Number 14 was discouraged by the FDA for decades and is now sold in pharmacies for $40 an ounce. And number 3 is the foundational practice that ties everything else on this list together, so universal among American grandmothers that no one bothered to write it down, because every farmhouse already had one. These were not folk superstitions. They were a complete system of household health care that worked well enough to keep American families alive for 300 years. They were not replaced because better medicines came along. They were replaced because the people who profited from the new medicines had every reason to make you forget the old ones. Hit subscribe. What you are about to hear is not nostalgia. It is the medicine cabinet your grandmother kept beside her wood stove, and every plant, oil, and tincture in it has been quietly validated by modern phytochemistry. The studies exist. The papers are published. You just never heard about them. Let us count them down. Number 25. Raw honey for wounds and burns. Before antiseptic creams existed in tubes, your great-grandmother kept a small jar of raw honey on the windowsill above the kitchen sink. When a child fell on the gravel walk or burned his hand on the wood stove, she opened the jar and smeared honey directly on the wound, then wrapped it in a clean cloth strip torn from an old shirt. The wound healed clean. There was almost never an infection. She did not know the chemistry. She knew the result. Modern wound care research has now confirmed exactly why the technique worked. Honey has a low water activity that bacteria cannot survive in. Its pH is acidic enough to inhibit pathogens, and as it sits on a wound, it slowly releases small amounts of hydrogen peroxide through an enzymatic reaction. A 2011 study published in the journal Microbiology demonstrated that medical-grade honey kills antibiotic-resistant strains of Staph and Myiaceae, the same bacteria that send modern hospital patients to intensive care. Today, the FDA has approved medical-grade honey for treatment of burns and chronic wounds. Hospitals stock it under the brand name MediHoney at $80 per tube. Your grandmother bought a quart of raw honey from the neighbor's hive for 50 cents and used it for the same purpose. The honey has not changed. Bees have not changed. What changed is that someone figured out how to package, brand, and sell what she got from a mason jar in the pantry. Number 24. Garlic as the household antibiotic. Long before penicillin reached rural America in the late 1940s, your grandmother kept a braid of garlic hanging from a beam in the kitchen and another in the root cellar. When someone got an ear infection, she crushed a fresh clove, warmed it in olive oil, and dropped a single drop of the infused oil into the affected ear. When someone caught a chest cold, she minced raw garlic into honey and gave a teaspoon every 2 hours. When a wound was already infected, she made a poultice of crushed garlic and applied it directly. The technique was not blind tradition. The active compound in fresh, crushed garlic is allicin, formed only when the cell walls are broken open. Allicin is a broad-spectrum antimicrobial that has been demonstrated in laboratory studies to kill bacteria, viruses, fungi, and parasites. The 4 categories of pathogen that modern medicine treats with 4 separate prescription drugs. A single bulb of garlic cost about a penny in 1935. Today, you can buy aged garlic extract capsules at the health food store for $30 a bottle, and the active ingredient is the same compound your grandmother delivered for free out of her braid in the rafters. The pharmaceutical companies could not patent garlic, so they spent 80 years convincing Americans that real medicine comes in a sealed plastic bottle. Number 23. Apple cider vinegar as the daily tonic. Every morning, your grandmother poured a tablespoon of raw, unpasteurized apple cider vinegar into a glass of cool well water, sweetened it with a little honey, and drank it before breakfast. She did the same for every adult in the household. Children got a half teaspoon. The practice was so universal across rural America that it appeared in farmhouse cookbooks alongside biscuit recipes and butter churning instructions. The vinegar was not a folk superstition. It contained acetic acid that supported digestion, the live cultures of fermentation that we now call probiotics, and trace minerals from the apples themselves. A 2007 study in the European Journal of Clinical Nutrition documented that 2 tablespoons of apple cider vinegar before bed reduced fasting blood sugar by 4% in subjects with insulin resistance. Other studies have shown effects on cholesterol, blood pressure, and weight. A gallon of homemade apple cider vinegar in 1935 cost effectively nothing. It was made from apple peels and cores left over after the autumn pies. Today, the global apple cider vinegar market is worth over $700 million annually, with branded health store bottles selling for $14 each. The vinegar your grandmother poured costs the same now as it did then if you make it yourself. The marketing budget that made it suddenly fashionable is what costs $14. Number 22. Onion poultice for chest cold. When a child went to bed with a deep chest cough, your grandmother sliced a yellow onion in half, warmed both halves in the oven for 10 minutes, wrapped them in cheesecloth, and laid them directly on the child's chest under the nightgown. By morning, the cough had loosened and the chest had cleared. The onion smelled of wood smoke and skin and worry, and every child raised in the early 20th century could tell you the smell. The technique appears in 19th century medical manuals as standard treatment for bronchitis. Onions contain quercetin, a flavonoid with documented anti-inflammatory and antihistamine properties, along with sulfur compounds that act as natural expectorants. The warmth of the onion against the skin increased local blood flow to the chest, while the volatile compounds were absorbed transdermally and through inhalation. The cost of an onion in 1933 was a single penny. Today, when a child has a deep chest cough, the parents drive to the urgent care clinic, pay a $200 copay, and walk out with a $40 prescription for an antibiotic that cannot kill a virus and a $20 cough syrup that sedates the child without addressing the cause. The onion still works. It is still a penny. The reason no one uses it is not because the onion stopped working. It is because no one taught the next generation how. First, pattern break. Number 21. Yarrow to stop bleeding. Here is where the suppression starts to look deliberate. Yarrow, a roadside weed with feathery leaves and tight white flower clusters, was so widely used to stop bleeding that its botanical name, Achillea millefolium, derives from the Greek hero Achilles, who used it to treat his soldiers' wounds. At the siege of Troy, during the American Civil War, both Union and Confederate field surgeons carried yarrow in their saddlebags for emergency hemorrhage control. They called it soldier's woundwort. They knew it would stop arterial bleeding when nothing else was available. They were right. Modern phytochemistry has identified the active compounds, alkaloids that constrict blood vessels, and tannins that promote clot formation. The U.S. Army's Wilderness Medicine Training Program still references yarrow as a field hemostatic. Your grandmother grew it in her kitchen garden, dried it in late summer, and crumbled the dried leaves directly onto cuts that would not stop bleeding. A handful of fresh yarrow growing in any North American ditch would stop a wound that today requires a $400 emergency room visit and a tetanus shot. The plant is everywhere. The knowledge is almost entirely gone. Every botanical guide in print describes yarrow as a common roadside weed. Almost no field guide mentions what it does, because the people who grew up using it stopped teaching their children, and the regulatory framework has carefully made sure that no commercial source can advertise its actual function without violating FDA rules on unapproved health claims. Number 20. Plantain leaf for stings and splinters. That broad-leafed weed growing through every crack in every American sidewalk is plantain, Plantago major. Your grandmother considered it as essential as bandages when a child was stung by a wasp or got a splinter that festered or scraped a knee on the gravel walk. She walked into the yard, picked a fresh, broad, oval leaf, chewed it briefly to break the cell walls, and pressed the wet pulp directly against the wound under a strip of cloth. Within minutes, the inflammation drew down, Within hours, the splinter migrated to the surface and slid out. Plantain contains aucubin, an iridoid glycoside with documented anti-inflammatory and antimicrobial properties, along with allantoin, a compound that promotes cellular regeneration and is now sold as a premium ingredient in $80 face creams. The leaf is free. It grows in every climate zone in North America. It is so common that most homeowners spray herbicide on it specifically to kill it. The plant your grandmother used as a drawing herb to pull infection from a wound is now the plant your neighbor poisons every spring with Roundup. Bee stings, bug bites, splinters, infected hangnails, blisters, minor burns. The same plant treats all of them. Modern outdoor medicine guides have started reintroducing plantain identification, but the knowledge that was once transmitted from grandmother to granddaughter is now learned from a YouTube video by adults in their 40s. Number 19. Mullein leaf steam for chest congestion. Mullein is the tall, fuzzy-leaved plant with yellow flower spikes that grows on roadsides and abandoned fields across rural America. Your great-grandmother harvested the broad gray, green leaves in late summer, dried them in the rafters, and kept them in a cloth sack near the wood stove. When someone in the family came down with deep chest congestion that would not clear, she put a handful of the dried leaves into a bowl of just boiled water, draped a towel over the patient's head, and had them inhale the steam for 10 minutes. The congestion broke, the cough loosened, the breathing eased. Mullein contains saponins that act as natural expectorants, and mucilage that soothes irritated airways. The plant has been used in traditional medicine for at least 2,000 years across Europe and North America. In the late 19th century, mullein leaves were sold in American pharmacies as a treatment for bronchitis and asthma. After the Flexner Report and the rise of patent medicines, mullein quietly disappeared from pharmacy shelves. Today, you can buy a small bottle of mullein tincture at a specialty herbal store for $25, or you can walk to any roadside in late August and pick a year's supply for free. The plant is so abundant that highway maintenance crews mow it down as a nuisance every summer. What your grandmother knew as the chest cold remedy is now treated as litter. Number 18. Peppermint for digestive upset. When supper sat heavy or a child complained of a stomach ache, your grandmother poured boiling water over a small handful of dried peppermint leaves, let it steep for 5 minutes, sweetened it with a little honey, and gave it to the patient. The relief was almost immediate. Peppermint contains menthol, a compound that relaxes the smooth muscle of the digestive tract, easing cramps and reducing gas. The plant grows so vigorously in any sunny patch of garden that it is considered invasive, and a single planting will spread for decades. Your grandmother dried bundles of peppermint in late August and stored them in tin canisters that lasted through winter. Modern gastroenterology research has confirmed that enteric-coated peppermint oil capsules are clinically effective for irritable bowel syndrome, with peer-reviewed studies in the British Medical Journal showing it outperforms several prescription antispasmodics. A bottle of those capsules costs $35 at the drugstore. A square foot of peppermint in a kitchen garden produces enough leaves for a year of tea, costs nothing past the original seed packet, and works for the same biological reason. The remedy is identical. The price difference reflects the cost of clinical trials, FDA approval, and corporate distribution, not the cost of treating an upset stomach. Second pattern break. Number 17. Chamomile tea for sleep and colic. Here is where the pharmaceutical industry's strategy becomes most visible. The active compound in chamomile is apigenin, which binds to the same brain receptors as benzodiazepines, like Valium and Xanax, the most prescribed class of anti-anxiety drugs in the United States. The mechanism is real, the effect is mild, and the herb has been used by every generation of mothers for at least 3,000 years to settle infants and help adults sleep. Your grandmother kept dried chamomile flowers in a small tin and brewed a weak tea for fussy babies, teething toddlers, and sleepless adults. The tea calmed without sedating, eased colic without side effects, and cost nothing. By the 1970s, the same active class of receptors had become the basis of a multi-billion-dollar industry built on prescription benzodiazepines, drugs with documented dependency profiles and severe withdrawal syndromes. Chamomile produces no dependency. It has no withdrawal. It has been safely given to newborns for thousands of years. A box of chamomile tea bags at the grocery store costs $4 and contains enough flowers for 40 cups. A single Xanax prescription costs more than a year of chamomile. Both work on the same receptors. Only one creates customers for life. The industry that profited from the prescription version had no commercial incentive to keep teaching mothers about the cup of tea version, so they didn't, and the knowledge faded. Number 16. Willow bark for pain. The original aspirin was a piece of bark. Your grandmother boiled a small amount of dried white willow bark into a bitter tea for headaches, joint pain, and fevers. The bark contains salicin, which the body converts into salicylic acid, the exact same anti-inflammatory compound that the German pharmaceutical company Bayer began synthesizing and selling under the brand name aspirin in 1899. Bayer's marketing campaign was brilliant. They spent millions convincing Americans that the standardized white tablet was modern, scientific, and superior to the bark of a tree. The bark continued to work. It still works. It has worked for at least 2,400 years, since Hippocrates wrote about it in ancient Greece. A pound of dried white willow bark from a herbal supplier today costs $12 and contains roughly the equivalent active dose of 200 aspirin tablets. A bottle of generic aspirin contains 100 tablets and costs $4. The economic value of the synthesis lies entirely in the standardization, the dosing precision, and the brand. The biological action is identical. Your grandmother's tea would not give you the precise milligram dosing of a tablet, but it would also not give you the gastrointestinal bleeding risk that comes from concentrated aspirin. Native peoples across North America used willow bark for the same purposes. The knowledge predated the patent by thousands of years. The patent simply rebranded what was already there. Number 15. Slippery elm bark for sore throats. When someone in the family came down with a raw, painful sore throat, your grandmother shaved a small amount of dried slippery elm, inner bark, into hot water. Let it sit until the bark released its mucilage, and the water turned thick and slightly sweet, and had the patient sip it slowly. The relief was immediate. Slippery elm bark contains long-chain polysaccharides that form a gel when wet, coating the irritated tissues of the throat and esophagus. The same compound is the basis for prescription medications for esophageal irritation that cost $80 per bottle. Slippery elm was so widely recognized as effective that the U.S. Pharmacopoeia listed it as an official medicinal substance through the 1960s. Then it quietly disappeared from official listings, not because it stopped working, but because no one was funding the studies required to maintain Pharmacopoeia status. Today, a small bag of slippery elm bark at a health food store costs $15 and contains enough material for 40 cups of throat-coating tea. The same 40 doses in lozenge form, branded and sold at the drugstore, cost $200. The bark has not changed. The tree species is the same. What changed is who controlled access to the information. Number 14. Golden seal root for infections. Here is the one teased at the start. Golden seal is a small forest plant native to the eastern United States with bright yellow roots. Your great-grandmother used the root tea for everything from urinary tract infections to mouth ulcers to skin infections. The active compounds are berberine and hydrostine, both of which have demonstrated antimicrobial activity in modern laboratory studies. Berberine in particular has been shown in peer-reviewed research to be effective against E. coli, streptococcus, staphylococcus, and candida, covering essentially the bacterial and fungal infections that drive most of urgent care medicine. Golden seal was so heavily used by American grandmothers in the early 20th century that it was harvested into commercial, near extinction, in the wild. By the 1990s, the FDA was warning consumers about unsubstantiated health claims, and the herb was being quietly dropped from mainstream herbal references. Today, you can buy a bottle of golden seal root tincture at a pharmacy for $40 an ounce, sold as an immune support supplement with carefully worded marketing that avoids any specific medical claim. Berberine has now become a fashionable supplement in its purified form, marketed for everything from blood sugar management to weight loss, with bottles selling for $50 at health stores. Your grandmother's bitter yellow tea was berberine. She just brewed it from the root instead of swallowing it from a capsule. The molecule has not changed. The price has multiplied by a factor of 20. Third pattern break. Number 13. Echinacea root for immune support. Notice the pattern forming. Every herb on this list shares a common history. American grandmothers used it. Native peoples used it for centuries before that. Then, in the early 20th century, the AMA and the pharmaceutical industry collaborated to discredit, restrict, or absorb each remedy. Then, decades later, the same compound or the same plant returns to the market in a packaged, branded, expensive form. Echinacea is a perfect example. Your grandmother grew the prairie purple coneflower in her garden, specifically for medicine. When the first signs of a cold appeared, she chewed a small piece of the dried root or brewed it into tea. The flu pandemic of 1918, which killed an estimated 50 million people worldwide, killed dramatically fewer rural Americans than urban ones, and one of the documented reasons was the widespread use of echinacea root in farmhouse medicine. By the 1930s, the introduction of antibiotics and the AMA's campaigns against herbal medicine had pushed echinacea out of the mainstream. By the 1980s, it had been quietly rediscovered by the supplement industry. Today, echinacea is one of the top-selling herbal supplements in the United States, sold in capsules and tinctures for $20 a bottle, with the same root your grandmother dug from her own garden for free. The plant grows wild across the American Midwest and is easy to cultivate in any sunny perennial bed. The knowledge of when to take it, how to prepare it, and what it actually does was once common parlance and is now the proprietary marketing language of a billion-dollar supplement industry. Number 12. Elderberry syrup for flu and colds. Every autumn, your grandmother harvested the dark purple berries from the elderberry bushes growing along the fence rows, simmered them slowly with honey and a stick of cinnamon, strained out the seeds, and bottled the resulting dark syrup in small jars stored in the root cellar. Through the winter, every family member received a tablespoon at the first sign of a sniffle, and a tablespoon every 4 hours through the active days of a cold or flu. The fevers ran shorter, the coughs eased faster. The whole household weathered respiratory illness better than the families that did not have a grandmother making syrup. Modern research has now confirmed why. Elderberry contains anthocyanins and flavonoids that have been demonstrated in peer-reviewed studies to reduce the duration and severity of influenza by approximately 4 days when administered at the onset of symptoms. A 2019 meta-analysis of multiple clinical trials confirmed the effect across multiple studies. Today, elderberry syrup is sold in pharmacies under the brand name Sambucol for $20 per small bottle. The brand has become a top-selling cold remedy. Your grandmother's version cost the price of a jar of honey because the berries grew along the fence row and cost nothing. The active compounds are identical. The price difference is the cost of marketing, distribution, and brand recognition. Number 11. Castor oil, the universal external remedy. Castor oil pressed from the seeds of the castor bean plant was a standard fixture in every farmhouse medicine cabinet. Your grandmother used it externally for an astonishing range of conditions. A castor oil pack, a flannel cloth saturated with warm castor oil and laid across the abdomen overnight under a covered, hot water bottle, was used for menstrual cramps, abdominal congestion, sluggish digestion, and joint pain. A small amount rubbed into a stiff joint relieved arthritis. A drop in the eye soothed irritation. A castor oil pack laid over the chest helped break up bronchitis. The technique was popularized in the early 20th century by the medical intuitive Edgar Cayce and adopted into rural medicine throughout the South and Midwest. The active compound is ricinoleic acid, which has documented anti-inflammatory effects and is absorbed transdermally through the skin. Modern research at the University of Maryland has confirmed effects on lymphatic flow when applied as a pack. A bottle of cold-pressed castor oil at the pharmacy today costs $12 and lasts for years of use. Modern pharmaceutical alternatives for the conditions castor oil treats, anti-inflammatory creams, prescription muscle relaxants, eye drops, decongestants, collectively cost hundreds of dollars per family per year. The oil that did all of those jobs at once is sitting on the bottom shelf of every drugstore, almost forgotten. Number 10. Mustard plaster for chest cold. When a child went to bed with a deep chest cold that the onion poultice had not fully cleared, your grandmother escalated to the mustard plaster. She mixed dry mustard powder with flour and a little water to form a thick paste, spread it on a cotton cloth, and laid the cloth on the child's chest with another cloth between the mustard and the skin to prevent burning. Within 15 minutes, the chest skin reddened, the warmth penetrated deeply into the lungs, and the deep cough began to loosen. The mustard plaster was a counter-irritant. The volatile oil in mustard, allyl isothiocyanate, drew blood to the skin's surface, increased local circulation, and dilated the bronchial passages through reflex action. The technique appeared in U.S. Army field medical manuals through both World Wars as standard treatment for severe chest congestion. Modern menthol-based chest rubs work on the same principle through different chemistry. A small tin of dry mustard powder costs $4 and contains enough material for dozens of plasters. A jar of branded vapor rub costs $9 and treats one cold. The effect is the same. The branding is what changed. Mustard plasters fell out of common use partly because they require a parent's attention for 15 minutes, and modern parenting culture moved away from hands-on remedies that demand sustained physical contact with a sick child. Fourth pattern break. Number 9. Ginger for nausea and seasickness. Ginger root has been used as an anti-nausea remedy for at least 2,000 years across multiple cultures. Your grandmother grated fresh ginger into hot water, sweetened it with honey, and gave it for stomach upset, motion sickness, morning sickness during pregnancy, and the nausea of fevers. The remedy worked across all of these conditions because the active compounds, gingerols and shogols, act directly on the receptors in the stomach and brain that mediate the nausea response. Modern clinical research has confirmed ginger's effectiveness for chemotherapy, induced nausea, post-surgical nausea, and motion sickness in studies published in peer-reviewed journals. The U.S. Navy historically included ginger in shipboard medicine kits for seasickness. Today, prescription anti-nausea medications like Zofran cost approximately $200 for a course of treatment and have side effects, including headache and constipation. A piece of fresh ginger root from the grocery store costs about $0.5 and lasts for 2 weeks of teas. The compound has not changed. Pregnant women who are advised against most prescription anti-nausea medications during the first trimester can safely use ginger tea, a fact your grandmother knew in her bones, and that is now considered alternative medicine. Number 8. Witch hazel for skin and bruises. Witch hazel is a small tree native to the eastern United States with yellow ribbon like flowers that bloom in late autumn. Your grandmother kept a bottle of witch hazel extract on the bathroom shelf at all times. She used it as an aftershave for irritated skin, as a treatment for insect bites, as an astringent for oily skin, as a wash for hemorrhoids, as a soak for sore feet, and as a compress for bruises. The active compounds are tannins, which constrict tissues and reduce inflammation, along with volatile oils that have antimicrobial properties. Witch hazel was so widely used in early 20th century American medicine that it was listed as an official drug in the U.S. Pharmacopoeia and was distilled commercially by the gallon. The largest commercial source historically was the Dickinson family of Connecticut, who ran a witch hazel distillery from the 1860s through the late 20th century. Today, witch hazel has been almost entirely replaced by 100 different specialized skincare products. Toners for $30, aftershave for $20, hemorrhoid creams for $15, eye creams for $50. The witch hazel that did all of those jobs is still sold at the drugstore for $5 a bottle, sitting on the shelf next to the products that replaced it. Number 7. Comfrey for broken bones. Here is the one teased at the start. Comfrey was once known as knitbone, and the name was not poetic. Your grandmother grew it in her medicinal garden specifically to apply to fractures, sprains, deep bruises, and slow-healing wounds. After the bone was set or the sprain stabilized, she made a poultice of crushed fresh comfrey leaves and applied it directly to the skin over the injury, changing it twice daily. Bones knitted faster, sprains resolved in weeks rather than months. The active compound is allantoin, the same compound mentioned earlier in plantain, which promotes cellular regeneration. Comfrey contains it in dramatically higher concentrations than any other common plant. The effect on tissue repair is so pronounced that comfrey was used as a battlefield medicine through the American Civil War, World War I, and into the early 20th century. The U.S. Army Special Forces Wilderness Medicine Training Program still references comfrey as a topical remedy for soft tissue injuries and slow-healing wounds. Today, comfrey is widely restricted for internal use due to liver toxicity concerns, which is appropriate. But the topical use that your grandmother knew has been quietly suppressed, along with it. Allantoin is now sold as a synthesized ingredient in $90 face creams. The plant that produces it for free has been pushed to the margins of legal availability. The root your grandmother dug from the garden costs nothing. The synthesized molecule in a fancy jar costs more than a week's groceries. Number 6. Spider webs to stop bleeding. This is where the modern listener's skepticism is loudest, and where the chemistry vindicates your grandmother most completely. When someone in the household got a deep cut that bled persistently, your grandmother walked to the corner of the woodshed, gathered a handful of clean spider webs, and pressed them directly onto the wound. The bleeding stopped almost immediately. The wound healed without infection. Spider silk is one of the strongest biological materials ever evolved, with a tensile strength comparable to steel by weight. The webs are mildly alkaline, which promotes blood clotting through pH-driven activation of the coagulation cascade. They contain vitamin K, which is the foundational nutrient for blood clotting at the molecular level. They are sterile in their natural state because spiders coat them with antimicrobial compounds to keep their food sources from rotting. Modern research at multiple universities has now investigated spider silk as a basis for surgical sutures and wound dressings. Companies are working to commercialize spider silk-based wound care products that will sell for hundreds of dollars per bandage. Your grandmother got the same biological action from a corner of the barn for free. The web she used was free. The chemistry was real. The only thing that has changed is who profits from the knowledge. 5th pattern break. Number 5. Sassafras as the spring tonic. Every American grandmother of a certain generation made a spring tonic. The most common version was sassafras tea, brewed from the bright orange roots of the sassafras tree, which grows wild across the eastern United States. Each spring, when the family had been eating heavy winter food and feeling sluggish, your grandmother dug a few sassafras roots from the woodlot, washed them, and simmered them with a little honey to make a deep, red, slightly spicy tea. The whole family drank it for 2 weeks. They felt clearer afterward. The skin cleared, digestion improved, energy returned. In 1960, the FDA banned sassafras as a food and flavor additive, based on a study showing that one of its compounds, safrole, caused liver tumors in laboratory rats fed extreme doses. The ban remains in place today, despite the fact that the same compound at the doses used in traditional tea preparation has never been demonstrated to cause harm in humans across 3 centuries of use. Sassafras was the original flavor of root beer until the FDA ban. The replacement artificial flavoring has its own questionable safety profile. Your grandmother's spring tonic is now functionally illegal to sell, while soft drinks containing genuinely harmful synthetic ingredients remain on every supermarket shelf. The plant still grows wild in every state east of the Mississippi. The knowledge of how and when to use it is almost entirely gone outside of small communities of herbalists who learned from elders who are mostly gone. Number 4. Black walnut hulls for parasites. Before commercial dewormers were available for children and livestock, your grandmother used the green hulls of black walnuts, harvested in late summer when the nuts had fallen, and the hulls were still green and pulpy. She dried the hulls, ground them coarse, and prepared them as a tea or tincture. The dose was carefully measured: a tablespoon of tincture for an adult, a teaspoon for a child, given on an empty stomach for 3 days. The compound responsible is juglone, a naturally occurring naphthoquinone with documented antiparasitic, antifungal, and antibacterial properties. The same compound is what makes the soil under black walnut trees toxic to many other plants. Your grandmother used it to treat pinworm infections, intestinal parasites, and ringworm in children, and to treat similar conditions in livestock. Pinworms in particular were a routine childhood condition before improved sanitation and modern dewormers. The black walnut hull tincture cost nothing. The trees were everywhere. The hulls were waste. Today, prescription antiparasitic medications cost between $50 and $500 per course of treatment, depending on the parasite. Black walnut hull extract is still available at health food stores for $20 a bottle, sold with carefully worded labels that do not make medical claims. The active compound is the same. The trees still drop nuts every September. The knowledge of how to use them safely has been lost in a single generation. Number 3. The herb garden as the family medicine cabinet. Here is the foundational practice, teased at the start. Every functional American farmhouse from the colonial period through the early 20th century had a small dedicated medicinal garden, usually within a few steps of the kitchen door. Your great-grandmother's garden was not decorative. It was a working pharmacy. A typical farmhouse garden contained chamomile for sleep and digestion, peppermint for stomach upset, sage for sore throats, thyme for respiratory infections, lemon balm for anxiety and insomnia, calendula for skin healing, lavender for headaches and nerves, comfrey for injuries, yarrow for bleeding, mullein for chest, plantain for stings and splinters, and tansy for repelling insects. The garden was tended through the growing season. The herbs were harvested at peak potency, dried in bundles in the rafters, and stored in tin canisters and glass jars in the kitchen pantry. The whole system cost the price of seed packets, about $2 a year in $1935, and produced a pharmacy that handled everything except major surgery, the knowledge of which plant to use for which condition, when to harvest, how to prepare, what dose, and how to combine remedies was the most valuable inheritance a mother could pass to a daughter. It was not written down. It was demonstrated, year after year, in the kitchen and the garden, until the daughter knew it the way her mother knew it. Modern American homes have ornamental landscaping that produces nothing useful. The medicinal garden has been almost entirely erased from American household practice in 3 generations. The knowledge that grew in the soil between the kitchen door and the back fence is the missing infrastructure of household healthcare. Number 2. Pine pitch and turpentine as antiseptic. Pine resin, the sticky amber-colored sap that oozes from wounded pine trees, has been used as antiseptic for at least 200,000 years across every culture that lived near pine forests. Your great-grandfather collected pine resin in a tin, hung on the trunk of a wounded pine tree, melted it down, and combined it with a small amount of beeswax or animal fat to make a thick salve. Your great-grandmother used the salve on cuts, scrapes, splinters, boils, and slow-healing wounds. It was sticky, unmistakably aromatic, and worked. Pine resin contains terpenes with documented antimicrobial activity, along with rosin acids that create a physical barrier against contamination. Pine turpentine, a more refined product, was a standard fixture in 19th century American medicine, used both topically for wounds and internally in carefully measured doses for respiratory infections, a use that is now considered too dangerous for general recommendation. But that worked when administered correctly. The pine tree was the family pharmacy of every settler community across forested North America. Today, the active compounds are present in commercial wound salves, selling for $15 a tube. The trees that produce them are everywhere. The knowledge that any wounded pine in the woods can yield enough resin to dress a year of cuts has been almost entirely lost outside of survival communities and primitive skills, schools. And number 1, the whole apothecary mindset. This is not a single remedy. It is the framework that contained every remedy on this list. Your great-grandmother did not have a medicine cabinet. She had a system of understanding. The system was rooted in 4 things: the soil of her own land, the woods around her house, the kitchen at the center of her home, and the patient observation of how plants and substances actually affected the bodies of the people in her care. She knew what grew on her land in every season. She knew what grew wild in the ditches and fence rows. She knew when to harvest each plant for maximum potency. She knew how to dry, store, brew, tincture, and apply each one. She knew the dose appropriate to a child of 3, a teenager, an adult, a pregnant woman, an elderly relative. She knew which combinations worked together and which were dangerous. The knowledge was a synthesis of 3,000 years of accumulated household medicine, transmitted through her own grandmother and her grandmother's grandmother, all the way back to traditions older than the United States. It included European herbal traditions, indigenous Native American plant medicine, and African herbal practice, all merged into a distinctly American synthesis. The 1910 Flexner Report did not just close medical schools. It was followed by sustained AMA campaigns to discredit traditional herbal medicine, by FDA regulatory frameworks that made it commercially impossible to sell most herbs as medicines, by pharmaceutical industry, advertising that defined real medicine as something that came in a sealed bottle from a licensed pharmacy. The result, across the 20th century, was the systematic dismantling of household medicine as a functional system. Most modern Americans cannot identify a single medicinal plant growing within 50 feet of their home. Most modern parents pay $200 to a clinic for treatment of conditions that any 19th century farm household would have addressed for the price of an onion and a cup of tea. This is not because the modern parent is foolish. It is because the apothecary mindset, the integrated framework that allowed the household to be the first line of medical response, was successfully stripped from American family life over the course of 3 generations. The knowledge survives, fragmented, in herbalism programs, in Appalachian folk traditions, in Amish and Mennonite communities, in indigenous knowledge keepers, and in a few grandmothers in remote places. But it is no longer the default knowledge of every American mother and grandmother. The compounds are not gone. The plants are not gone. The chemistry is not in dispute. What broke is the chain of transmission from mother to daughter to granddaughter that carried the knowledge forward. Pick one, just one. Plant a chamomile patch this spring. Buy a quart of raw honey from a local beekeeper. Learn to identify plantain on a walk through your own neighborhood. Make a small jar of elderberry syrup next September. The reclamation of household medicine does not happen all at once. It happens through the same patient, generational practice that built it in the first place, through one cup of tea at a time, one wound dressed with the right leaf at a time, one season of harvest at a time, one mother teaching her daughter at a time. The knowledge your great-grandmother held is not lost forever. It is documented in herbal medicine programs, in printed materials, in 1,000 specialist communities, in YouTube tutorials, in the pages of any honest field guide. The plants still grow. The compounds still work. The chain of transmission can be rebuilt. It will not look exactly like it did when your great-grandmother was alive. The framework, however, is recoverable. The pharmacy is in the garden, the woods, and the kitchen. The chemistry is real, and the only missing piece is the woman or man, the mother or grandmother, the father or grandfather, who decides to learn it back and to pass it on, so that some child 100 years from now opens a small jar of honey on a windowsill and uses it for a wound, and the chain holds. The medicine cabinet your great-grandmother kept beside her wood stove is still possible. The plants are sitting out